So I just wanted to talk a little bit about tennis elbow. It's an injury we've seen quite a bit of recently. So what kind of things can cause it? Well, it's usually repetitive action and something that's slightly different to what you'd normally do. So if someone suddenly takes up tennis or starts playing tennis with heavy balls, so wet balls, that's often a trigger. Squash can be a similar kind of thing, or an increased amount of squash. However, often it's nothing to do with tennis at all. So it can be something as simple as holding a paintbrush, a paint pot. It can be a repetitive action such as throwing with a dog toy, with a dog thrower. It can be from texting too much. There's so many different ways it can be caused, but it's a repetitive action, something different. And it's a tendon that's just where all the muscles here come through, attaching to a common tendon region here, and then that attaches onto the bones. It's inflammation, irritation, and a tendinopathy of that area is all classed as a tennis elbow. Tendons don't like change, and that's the most important thing, is that if you do things gradually and build up gradually, it can cope, but as soon as you do too much, it doesn't like it. So ways to kind of look at the diagnosing it, I suppose, or having a clue that might be the problem. We do a very simple test where we do a resisted pushing up of your middle finger, a resistance of all the fingers being pushed up at the same time, and then resistance of the whole wrist being pushed up. If that's sore, usually that suggests you've got tennis elbow. Not always. We can then also do it with your arm out straight. That then gives less stability at the shoulder. It's harder to stabilize the shoulder and coming through here. And then again, you may test more or less positive as a result. 75% of tennis elbow comes from the fact that the shoulder doesn't function properly. So always looking at shoulder when we're looking at rehab as well, just to make sure we're keeping everything in the whole chain working properly. So what do we recommend treatment-wise? Well, often if it's been there a little while, it's certainly what offers shockwave therapy, which is an aggressive form of therapy, like ultrasound, but a lot more powerful. And then that is a great way of treating the actual symptoms. In terms of the cause, like I said, you need to look further up the chain. And in terms of exercise, you want to be looking at loading the tendon. The tendon doesn't like rest as such, so it doesn't like change, but it doesn't like rest too much. So we need to load it in a certain way to encourage some healing to take place. A very simple way of doing it is taking a weight, or if I haven't got a weight, I've got a bottle of water, and with your arm resting on something, so the side of the sofa is ideal. I've got the side of my chair here, or a desk would work really well. And you're looking initially, if it's really sore, we're looking for just holding that weight. Your wrist is just off the edge of the surface, and you're going to hold 45 seconds times 5. And that's every other day at most. That helps to stimulate the healing process to go on within that tendon, just by loading it a little bit. If you can tolerate that, it's not too bad, then we look to go down slowly and up slowly. And that's 3 seconds down, 3 seconds up. Okay, so really slowly control. We want to do 15 repetitions times 3, and if that's too easy, you need to make the weight a little bit heavier. If it's too hard, you need to make it a little bit lighter. Then eventually you go on to a heavier weight, and you pull up with one hand, and you let it drop with the other. So you're just doing the drops, okay? And it's a 12-week program. You usually do about a couple of weeks of isometrics for the holds. You usually do about 6 weeks or so of the up and down, slowly, slow heavy resistance, and then you do the rest of the time just doing the drops. But obviously that's very individual, and it will change depending on your symptoms. Self-massage is also really, really effective. So you're looking at the muscles here rather than actually where you get the pain. You're working through freeing up all the muscles in there. We also have, I know people that get rolling pins on the side of the sofa and go through into there, or a wine bottle, vodka bottle is just as effective at getting through and freeing up all the way through those muscles. Then we're looking at potentially using a tennis elbow strap. They can reduce the amount of power that the muscles can create in here. So that will reduce the amount of pulling on the tendon. The main mistake most people make is they put it over the pain. You actually want to put it below the pain, or over the muscle belly. And that pressing down on the muscle belly will reduce, like I said, the amount of power that can be created, therefore take a bit of pressure. So if you are still playing tennis, or something similar like that, and you get a lot of pain, that is a good way of doing it. I'm not saying you should be playing tennis, but if you decide to do so. So that's just the tennis elbow strap. There's lots out there, just find one that works for you. You can do a stretch. This has mixed effects. Some people like it, some people don't. So just have a go at it, and if you think it's irritating, it stop. It's very simple. You're literally pushing your hips down and flexing the fingers round into that position, and you should feel that pulling it here. You may want to twist it one way or another to make sure you target the right area, but ideally you want more in the muscle than you do in the tendon, and I'm not a big fan of being pulled too much. You can put a bit of ibuprofen gel over the area itself. Sometimes it has some benefits, sometimes it doesn't. So literally see how it feels, and if it works, it doesn't. Anyway, any further questions, or you want some more advice, or more detailed diagnosis, please get in touch. Otherwise, good luck.